Hello everyone, I'm Irma Baker. Welcome to our show. We're so happy to have you with us today. And our show today is, well, it's going to hit home to a lot of us. If you have a pet, then this is a very special show for you. Our guest today is someone who has worked with veterinarians for a long time in a very special, and I'm learning, a very important element of pet health, and that's their dental health. So welcome, Tim Smuds.
Thank you very much for having me today.
Well, I have had cats, and I have friends who have dogs, and we just have these pets who become part of the family.
Right, absolutely correct.
What, I never really thought, other than their regular veterinarian visits, what I should be concerned about in terms of their health. And now you're going to tell us about dental health.
Right, absolutely. As a matter of fact, dental health is a very important point to take with your veterinarian and at home with your pet. What you can do is actually you're going to see your veterinarian every year, and he's going to be checking the animal out. Now, the biggest concern we're having here in pet health, pet dental disease, is the fact that sometimes these things get overlooked. And today we're going to talk about that. I'm going to show you what this is all about, and we'll go from there.
Okay, well, really, where do we start?
Where we start, let's just call it periodontal disease. Periodontal disease is a chronic infection of the gums. It occurs in all animals, all dogs and cats for sure, and humans as well. Before we get into too much of this, I'd like to throw a couple things at you because we're going to talk about basically bacteria here. Mm-hmm. Bacteria is the big problem that we deal with on a daily basis with animals. As a matter of fact, with us too.
Well, you know, we have some slides up right now.
Right, and now in that case, if you look at gingivitis, we're going to be talking about that in just a few minutes. But you can see the bacteria content is important here. We have what we call aerobic bacteria. That means it needs oxygen. Then we have anaerobic bacteria, and that's the more concerning one because that does not need oxygen. In the early stages of periodontal disease, what we're talking about here is a situation where it's not too bad. We can do something about it. And it's a normal thing. In gingivitis, we're talking about much more aerobic bacteria. So the point is, your animal starts having bad breath. Now that's another thing. When you start smelling breath, that's the thing that you need to think about. Because if you start smelling bad breath in your animal's mouth, there's a concern with the teeth. And you need to get it looked at. What you do in gingivitis cases, it's totally reversible. We have no problems at all. So what you do is you take your animal in and get it completely dental. We call it a prophy in the business, but you guys, we call it dentals. So you go in and get a complete dental done. All of a sudden you look at your dog's teeth, the tartar and the plaque is all gone, it's all shined up. Now there's a couple terms that I just mentioned right here. We have plaque and we have tartar. Most of us might know what that is, okay? But what plaque is, it's a film substance, it's totally bacteria.
Well, this is a lot like what we go through with our own dental visits, isn't it?
Absolutely correct. It's the same bacteria, and it's all bacteria. And as a matter of fact, if you want to know what plaque is, before you brush your teeth in the morning, just run your tongue over your mouth and you'll over your teeth, and you'll find that what it is, that's the plaque. It's normal. It's normal flora for the mouth to have bacteria there. It's when it gets out of sync that's the problem. So in gingivitis cases, it's totally reversible. It's very cool. You might smell a little bit of bad breath. Now, by the way, just to let you know, this is the most common thing that veterinarians see in their practices today. It is. Also, another thing is 95% of the pets that are 2 to 3 years old are going to have a problem with this, and we need to look at it. And it's not hard to do when we're in gingivitis state.
Is gingivitis something that in a normal annual checkup with your vet that they would look for and find, or is this something you have to ask your vet specifically, check the teeth, check the breath?
Well, quite frankly, when you go into the veterinarian's office, these guys and gals are really sharp. And that's the first thing they're going to do is check your pet's mouth. And gingivitis, you know, is swelling of the gums. And it's the gums get red, they may bleed, but when you do the dental, it takes it all away, and no problem. Now there's the second form of it's called periodontitis, and that's a different scenario because that's not reversible, and that's a real problem. And we were talking. Go ahead.
If it's not reversible, is there a way to prevent it?
Well, that's the thing. Once we get into the periodontal stage, periodontitis stage, you have to work with the veterinarian. He's going to maybe end up pulling teeth and really doing some serious problems. Now, here's the problem with periodontitis. Now, once we get into periodontitis, we're talking about, first, the bacteria shifts. It shifts. It's no longer the way it was with gingivitis. We're talking about 90 to 95% anaerobic bacteria and 5 to 10% aerobic bacteria. That's a big shift in bacteria, and that's the real problem.
Can you tell us again the difference between the two?
Gingivitis is reversible. You smell a little breath that isn't so bad. That's the one thing you can look for here at home. If your animal's breath starts to smell funny, you need to get set up a deal with your veterinarian and go in there and see them, and they will take care of that. No problem. Periodontitis, they're going to have to do a lot more work to save the teeth and things like that. Some teeth may have to end up being pulled. So that's where we're dealing with periodontitis. It's a nasty thing. Also, with periodontitis, that's where we have to really worry about that anaerobic bacteria that goes down into the gums, into the bloodstream, because now when the animal tries to eat his food, for instance, he ends up opening up his gums, and that bacteria gets in the system. At that point, we're talking about serious problems because we could have heart problems, kidney problems, anything like that can develop out of that. So that's why, quite honestly, it's very important on a yearly basis to have your veterinarian check your animal out. If you have the bad breath, you really got to look at it closely because in the periodontitis stage, we're talking really serious stuff here. We're talking really smelly breath. You don't want to be in the same room. You don't want to be around the dog or the cat. I mean, it's not good. And that's where we have to worry about our pets. I'll be honest with you. Now, I had my pet for 17 years, a dog. And he made it 17 years. He had all of his teeth. No problem with that. And he didn't lose any teeth. All 42 teeth are fine. So we did good on that. And we had no periodontal problems. But I had him go to the veterinarian every couple years and definitely have a dental done. That's very important. So
I think the thing that's hitting me here, and maybe that's more accurate or authentic than even it seems, is that if you're hit with bad breath from your animal, from your dog or your cat, don't wait for the annual visit. Go in, make an appointment with the vet, and have it checked out. Don't let it go to the point where it's going to develop these very serious problems.
You're absolutely right. You cannot take a chance. As soon as you smell the bad breath, that's the one thing we can do at home. Smell the bad breath, call your veterinarian, and let him take it from there. Every scenario is different here. I mean, we can't say it's going to be this way, that way. I've seen animals where they've had to pull 9 or 10 teeth out. We got to understand, dogs, and here's another thing, dogs have 42 teeth. All dogs have 42 teeth. All cats have 30 teeth. Now, your smaller breeds are more likely to have periodontal problems because their jaws are smaller and there's not a lot of room for their teeth. It all depends on the various breeds, but that's important. So you got to be more cautious with your smaller breeds than your larger breeds, although it's a problem in all of them.
Are you talking there about both dogs and cats?
Yes, ma'am, I sure am, yes. And here's a couple other things too. By the way, on tartar, and just a point of information, when we're talking plaque and tartar, and we're more common with us. But tartar is plaque that's hardened. And plaque hardens in like 48 hours. And then the animal chews that, and that's what causes all this. So that's why you got to get rid of the tartar. The tartar is alive. Even though it's hard, it's alive, and it's causing problems. So that's a real scenario that you need to just know about.
Well, we'll talk a little later about what we can do at home to help prevent this.
Oh, as a matter of fact, we're going to talk about that right now. There's some really cool things that you guys can use, and it works well because this is what I used, and that's one of the reasons my dog stayed around so long. And you guys want to keep your pets around a long time. You don't want them to die prematurely, and by taking care of the teeth and knowing that this is a concern, you're going to solve a lot of problems that way. So let's talk about that. Is that all right?
Sure, let's do it.
Okay, well, first thing I would talk about, and I use this a lot, this is the concentrate, the water concentrate. Now what you do with that is you put that in the animal's water dish. You put a capful in the water dish.
Now I'm going to stop you right there and ask, when you say a capful, and I imagine there are different brands and such, you can ask your vet what they recommend.
Correct, absolutely.
When you say a capful, does it depend on the size of the animal or the amount of water?
No, I'm not 100% sure on that. I just put a capful in my dog's water dish every morning when I filled up the water. Same thing with the cats. And I'll tell you what that does is that helps eliminate the plaque that's in there.
Does it change the taste at all for the animal?
No. I had to check that out myself just to make sure. And it makes no difference. The pets are going to still drink the water, no problem. But that helped out a lot just doing that. Mm-hmm. That's the first thing you ought to think about doing. The second one would be a rinse that the veterinarians can put in. You have to go to them for that, and they can explain all that to you. Then I would necessarily go to the chews. We don't have a chew here, but you're used to the chews. And here's the thing about chews. When you give a chew to an animal, they chew it and they exercise their teeth back there and they knock out that plaque and that tartar. Maybe not the tartar so much, but keep the plaque at a minimum. That's why chews are really, really important to do that. They help out a whole lot.
Are chews more commonly used with dogs, or are there chews for cats as well?
I think there are some chews for cats. I'm not aware of a lot of those, but they're there. Another thing too, and this you see your veterinarian on this because they can advise you. There is a food available that you can use for your pets. I would also recommend, because all I've ever used, and veterinarians told me this a long time ago, hard dog food and hard cat foods. They work the same as the chews. They will go in there and when they're chewing them down, they're making it so that they're hard on the plaque and the tartar and eliminating it. So it's helping a lot to use that. So, but the number one thing I would really like to think about, and you guys think about, because this is what I did. This is what kept my animal alive for so long. Brushing your animal's teeth. If you can do that.
Oh, come on. I'm supposed to brush my cat's teeth?
Yeah, and I will tell you right now, when it comes to cats, this is not necessarily an easy thing to do. And dogs too. It's not necessarily easy because, first of all, they're not used to having anything around their mouth. What I would do is, well, first of all, let me show you this. These are the toothbrushes that are available, and I personally go for the finger brush because it's less scary to
So that's
animal.
The green thing that's on the
That's the green
screen.
thing that you have there. That's the one. The toothbrush is good. They're real soft and it works real well, but it's another step that you have to take because these animals are not used to anything around their mouth. So I'm going to show you in a minute here how you would start the animal off, because my animal wasn't all that keen on me doing his teeth either. It took a little while, so we'll talk about that in a second. But I would definitely stay with the finger brush. And when we're talking about brushing teeth, we're talking about using a dentifrice. We do not ever want to use human toothpaste. That is contraindicated for animals, and it should not ever be used.
So when you say that, it's bad for animals.
For dogs and cats we're talking about. Mm-hmm. For us it's great, but not for pets. They have a special toothpaste out there, and quite honestly, the toothpaste tastes good for the cats and the dogs. It tastes like chicken or beef, and this is kind of like what it looks like, one of these. But never use human toothpaste when you do this. Now,
And I would say also, this is another thing where you would ask the vet to make a recommendation.
oh yeah, as a matter of fact, the veterinarians will probably be able to show you how you should brush your animal's teeth, because it's first thing when we talk about brushing teeth, we never do the insides, so you don't have to worry about having the animal open up his mouth and no, that's just a lot of trouble. But the outsides are what we need to be concerned with. The tongue does a good job on the inside, so we worry about the outside of the teeth and the buildup of the tartar and the plaque.
Okay.
So let me show you, if it's all right with you, I will show you how I started brushing my dog's teeth. And like I
Okay.
said, don't expect this to happen overnight. What I would probably do is I'd sit around on the floor with the pet or in your chair when the pet's sitting with you, and just kind of let him get used to this. Just kind of brush and just like that, and he's going to kind of go back. You know, he's not going to like it so much, but just hold him like this and just do that, and then do it on the other side over here. And that's to start them off.
Let me try this.
Well, you got a cat, so let's do
Oh.
the kitty cat.
Okay.
And again, it's going to take a little time to do it because cats are worse than dogs. I can call a long shot.
So, okay, I would be holding it.
You hold it like that.
this,
Yes.
And then.
And then just run your finger along there. Now, he may
So
not
this
even
is
let you get that far.
inside the mouth.
Inside the mouth, inside the
So
cheek,
it might
along the
take
teeth.
months before I
It
can.
could. It may take, I'd like to think days, but not for cats. I think cats are going to be a little longer than that.
I would think
Yeah,
so.
I think so.
So now, what would I do? How would
Well,
I
you
do
just
this?
take your index finger and you start off here and run them all the way back just like that. That's all. Now the point is the cat's not going to let you do that right off the bat. You may take you a while for the cat just to let you get around their mouth. Dogs are a little bit better. There's some dogs that'll never let you do it, and some cats that'll never let you do it. So you have to use the other methods.
So, and what are those other methods?
Well, the other methods would be you'd have to go to your veterinarian and let him use the chews as much as possible. Use what you can do that way, because
So use dry food.
dry dog food for sure.
I mean, it's not you're not saying they can only have dry food.
No. There are some animals that can't use anything but the soft foods, and that's okay. But this is just another method of doing it.
So, okay, so the hard food is one way. Chews. Add some chews of some kind if they're available for more so for dogs than for cats.
Definitely for dogs. There's a lot of them out there, and you got to be careful because some of those are not good for dogs. I've had people say, and I'm not going to mention anything, but there are certain things that dogs probably should not have. So you got to be careful of that. Oh, and another thing, when we're talking about these hard dog food and cat foods, we don't ever want to have these guys. We want to make sure they have the right foods, and the one thing I wanted to talk, I'll just mention that in a minute here, but that's the important thing is on your dog foods and your cat foods to use a product that the veterinarian knows is a good product for your pet. Don't mess around with doing something if you're not aware of what it'll do. Oh, I know what I wanted to mention. We should never let our pets eat anything but dog food and cat food.
You're saying no table food.
Right. Now, maybe if you're licking up maybe eggs or something like that but no donuts and nothing like that. The dogs and cats are carnivorous. They're not supposed to eat that kind of stuff. So you need to stay off that as much as possible.
Are they gluten-free? I mean, are
Now
they?
that I honestly don't know.
Okay.
I've never even worried about gluten in my whole life, so I mean that's not something I gotta worry about. But getting back to this now, after you get that animal and he starts saying, okay, this isn't a bad deal, this isn't so bad. Okay, then you may take a step where you just put the toothpaste on and run it down your finger and let him taste this because it tastes pretty good. So you start off this way, you hold the animal's and just go, and he'll move his arm, and you get those back teeth really good. But right now we're just letting him get used to it. Then you put the finger brush on, and you put toothpaste on there, and then you really, really work it when he gets used to the idea. That's what it's all about. So, and then you switch hands, and do it on this side, right along there. And I'll tell you, it works. It works well if you can do it. So.
And if not, the vet.
The veterinarian is your best choice for any of these things. He can definitely tell you what's going on. And like I said, every scenario is a little bit different. So this is a big problem in the veterinary practice. They see it all the time, and they know what they're doing. So they can guide you in your specific place. If you can't be using a toothbrush, okay, they'll work out something for you to help you.
So they are your partner, and I'm saying it's not just the vet, but it's the vet tech and the office staff and all. They're going to be the people who can actually tell you, yeah, for your dog or for your cat, this is what you should be doing.
Right. Here, I'll tell you this story. This is kind of a funny story about bad breath, okay? Because we talk to veterinary clinics about bad breath, and we talk about the receptionists are very busy people. But what I was always telling them, what you do is you ask the client if their animal has bad breath, and that will key the technician, who keys the doctor, and go from there. But in this case, grandma brings in the dog, and little girl grandchild is there, and the receptionist asks her, well, does your dog have bad breath? Oh no, my dog doesn't have bad breath. No way, no. The little girl looks up at her and says, Grandma, you're kidding. That is terrible breath. So I mean, that's unfortunately, I guess when we get a little older, things like that might happen. Anyway. But.
Well, I can see where Grandma wouldn't want to admit that the animal has it.
You know what,
but
at my
that's
age,
not
I
the
got to
point.
admit it too once in a while. You know, it's the way it goes.
Yeah.
So, yeah. So anyway, that's pretty much everything about this particular problem, and it can definitely be solved if you take the time to really look at what's going on, seeing your veterinarian, and they can guide you. When we're talking puppies, by the way, this isn't a real concern in puppies. I mean, as the pet gets older, 2, 3 years old, that's when you start smelling a little breath that might not be right. If you look at the teeth, if you're a chance to do that, okay, you'll see the tartar on the teeth. It's there. You can't avoid it. It's there. But it's not in any content that's going to cause any problems. When we're talking about the other serious porn, that's the dogs that are quite a bit older, and you know, they don't brush their teeth like we do. I mean, if they could brush their teeth, they'd be fine, but they're not, and they're never going to. So, I mean, that's where we're at.
But I think one of the things, too, that we should stress is you don't want to force yourself to do it yourself. I guess what I'm trying to say is, if it's really difficult for you, it's perfectly fine to just take it to the vet. Make that appointment.
You're right. They deal with this all the time. I mean, it's a big deal to them. It's the biggest problem that they see in veterinary medicine, and they're very good at it. And if one of these things doesn't work, they'll work something out for you for the other thing. The main thing is you're taking good care of your pet. We want to have these pets stay with us. They're part of the family, man. I mean, when that dog passed away, it was hard on the whole family. I mean, but at least he didn't die of anything with periodontal disease. So, I mean, that worked out very well.
Well, we only have a couple minutes left of our show. It goes so fast.
Yes, it sure does.
What would you really want our audience to know now that we haven't talked about yet?
We've pretty much talked about all of it. The main thing is look at your pet closely and observe him. He may have a chewing problem. That could be another concern. We're talking basically bad breath, but it could be a chewing problem or something else going on. And we need to have the veterinarian and professionals looking at these animals and make sure, and you'll be a lot happier and they'll be a lot happier. Your pet will be a lot happier, a lot more energy if you take care of them. It's super important.
So it sounds to me like what you're saying is that this is teamwork. It's you and your pet, and it's you, your pet, and the vet technician, the
Oh, yeah.
receptionist.
Oh,
You're
yeah.
a team that are
Absolutely.
keeping your animals to be with you for a long, healthy time.
Certainly. I mean, when you go into the veterinary clinic, the veterinary technician the doctor will put your animal under anesthesia. It has to happen that way. They do not ever do it without anesthesia. And that way, they can completely work on your animal's mouth. The technician does all that. It may take her an hour, hour and a half. She's got to clean all 42 of those teeth, or all 30 in the case of the cat. I mean, that's the key. And has to take out all that tartar, and they'll use what they call a probe to go down. We have the same thing in us. I probe in my teeth. They probe the animals 4 times on every tooth to make sure they don't have any pockets. Pockets, by the way, are caused by the tartar. And so they eliminate that tartar, and they can take care of these pockets. That's a more severe problem. You're talking about periodontitis problems when you get there.
So you can prevent that by having good dental care for your dog or your cat.
No question about it.
Right from the beginning.
Absolutely. The only point is that most people are not aware of breath smells. They're not really that aware of it. Now, I'm hoping with our program here that they'll get a little turned on and take care of their pets a little better.
Well, thank you, Tim, so much for sharing all this with us and all that good advice and good help. So all of you, I hope that you have enjoyed this show, and I hope you've learned how to take care of your pet's dental care. For RSVP, I'm Irma Baker. Thanks for being with us, and have a wonderful day.
You are watching WCTV, Wadsworth Community Television.